Have you ever considered receiving injections of potentially harmful substance? Hi, my name is Abby Potter, and today I will be giving you information on Botox and other dermal fillers. In the last 5 years in the United States, Botox procedures have increased 40.6%. In this speech, I will cover what Botox is, what it can be used for, the effects of Botox, how long it will last, and finally, how much it costs. In an article on medlineplus.gov, they define Botox as a drug made from the toxin produced by the bacterium Clostridium botulinum. This is the same toxin that causes food poisoning. Well, in 2018, it was found in an article by the American Society of Plastic Surgeons that around 7.4 million Americans received Botox and 2.6 million Americans received dermal fillers. That's a lot of Americans injecting themselves with harmful substances in 2018. Well, in 2016, by National Post, we see that almost 60% of those receiving Botox are between the ages of 45 and 54. In the same article, it is stated that almost 20% of those receiving Botox are between the ages of 30 and 39. Botox injections have many uses, such as fixing a lazy eye, fixing cross-eyed, uncontrolled blinking, and preventing migraines. However, the most common use of Botox injections and other dermal fillers is to smoothen out the appearance of wrinkles. Botox and other dermal fillers, such as Dysport, work to smooth wrinkles by blocking the signals from the nerves to the muscles. This relaxes the muscles, so that when someone gets Botox or another dermal filler in their forehead, it prevents them from raising their eyebrows, and this reduces the appearance of wrinkles. On average, Botox costs about $20 per unit. So if you get 20 injections in your forehead, that will cost around $400. My mom uses a filler called Dysport, which is similar to Botox. Dysport takes effect sooner but does not last as long as Botox when trying to smooth wrinkles. Botox, however, does not take effect as soon, but it does not last much longer than Dysport. So what does it look like during your first visit when receiving a dermal filler or Botox? Typically, you receive these fillers by a doctor or someone who has trained in giving them in a dermatologist's office or a plastic surgeon office. The doctor will administer a dozen or so shots of Botox or dermal filler in your forehead. You can also get injections right here where you get wrinkles, here where you get wrinkles, here in your cheeks to plump in your cheeks and raise your face, or in your lips to plump in your lips. My mom gets Dysport injections in her forehead, and she gets about 15 to numb the muscles and reduce the appearance of wrinkles. After you receive injections, you cannot lay down for at least 4 hours. You may also want to ice the area with an ice pack that they give you because of redness and swelling after all the injections have been shot into the area with a needle. The Botox or other dermal fillers do not go into effect immediately, and so over the course of a few days, around where the injections were, you will start feeling paralyzed. After around 2.5 to 3 months, you will want to get your next set of injections as the previous medication from the injections wear off. Some famous people who have received Botox injections include Kim Kardashian, Simon Cowell, and Cindy Crawford. Kim Kardashian was so comfortable with receiving Botox that she allowed an episode of Keeping Up with the Kardashians to be filmed while she received her injections. Botox and other dermal fillers do have some negative side effects, but they are not common. These side effects include pain at the site of injection, because it's a shot with a needle, infection, because it's a needle if it's not clean, swelling, redness, and bruising. Typically stuff that you receive after getting your flu shot in your arm. If you have any further questions about Botox or any dermal fillers, please let me know. I hope this information will help you in deciding if you want to pursue Botox or any other dermal fillers. Thank you. I hope you all stay safe on your coronacation.